Hello everyone, this is Dr. Poornima from Hills Dental Design, where beautiful and healthy smiles begin. Guess what? This week is Women's Health Week. So this week is Women's Health Week, and I thought it would be good to talk about dental health, women's dental health. Now, as you know, there's a lot of phases in women's life where they go through a lot of changes, the hormonal changes. So you've got puberty, and you've got pregnancy, and then menopause. So how does that affect your oral health? So say, for example, puberty, there's a lot of hormones, raging hormones, and you might get canker sores, or your gums might bleed. More so closest to your periods as well. So you need to know what triggers and what are the factors which triggers your gum health. So say, for example, the bleeding can be because of the hormonal imbalance, or you have to be mindful of what you're eating, because you might have some sugar cravings, you might not be eating properly, and those mood swings as well doesn't help. So how can you have better dental health? So just make sure that you eat better and you brush and floss every day. Now with puberty, because you're young, it's easy, so you don't have any long-lasting impact if you just look after your oral health. And remember to go to the dentist. Now, when you get pregnant, again, there's a major shift in your hormones. And some people might get pregnancy gingivitis. Pregnancy gingivitis is inflammation of your gingiva because you're pregnant, because of the hormonal changes. We don't call it an imbalance, but we call it an hormonal changes. And you might also have some sugar cravings or some weird cravings. So some people have a lot of cravings and they just have to eat, and also the timing when you eat changes. So some people might become snackers, they're really hungry, or you can't keep your food down. So you might end up throwing up, or morning sickness can be terrible for some people. And that changes your oral health. So say, for example, if you have a lot of morning sickness, you might actually end up with acid erosion of your teeth, especially the back of your upper teeth. We see that the enamel gets worn down, and that's because of the morning sickness. Now for that, what we ask you to do is to make sure that you brush your teeth with some fluoridated toothpaste, and not to eat or drink acidic foods, simply because that will add on to what you're actually feeling already. And make better food choices if possible. So even if you have a craving, yes, go for it, because that's the time of your life you want to have a piece of cake, or I'm talking when you're really healthy and you say, oh my god, I'm having this piece of cake right now, or a tub of chocolate ice cream. But just make sure you brush and eat properly. So if you manage what you eat, your hormonal balances won't fluctuate so much, and you can have better oral health and then overall health as well. So the other thing I want to talk about is so after pregnancy, of course, the next phase of your life is menopause. So that's, again, there's a shift in the hormones. You do lack estrogen, and what happens then? Sometimes you might get altered taste or sensation. Some women feel burning sensations in their mouth, dryness. So for that, we ask patients to avoid spicy food, avoid things which can trigger the pain. And also, if they have dry mouth, please drink plenty of water as much as possible. And instead of having big gulps of water, just sip it throughout the day. Now, they have other dental products in the market like biotin, which you can apply so that you can just have relief of those symptoms. The other thing with menopause is bone density. So that decreases your bone density, and you might be more prone to breakages in certain with your teeth as well when you're having an extraction. That can pose a problem if you are under certain medications. So please make sure you look after your oral health. And in every phase of your life, your gum might just get inflamed, and that means your hormones are not balanced. So we know a lot of things happens in a woman's life, and we just want to make sure these are the three big phases. Now, how can you prevent or have good oral health? First of all, prevention is the key. Just knowing that you might possibly go through these changes and be prepared for it is the biggest key. Please have a regular dentist so they can see you through, if possible, different phase of your life. So when that happens, you're more prepared, and your health practitioner or your dental practitioner can help you through those phases. Make sure with your cravings that you manage your food and also have a moderate, well-balanced diet. Obviously, we say no to alcohol, to excessive alcohol intake or smoking, or just generally the food what you eat is very important. So watch out for that. The other thing which has personally helped me a lot, and which I do talk about a lot, is yoga as well. So any kind of meditative techniques that basically when you do that, it automatically reduces your cravings, and and then you will be more, your mind is more at rest. You will look after your oral health and your general health. You will make sure your routine is good and you are in a routine, and take care of your health. Because at the end of the day, that's what you've got. You've got to invest in your health. That's very, very important. So it's very simple. Just make sure you always take care of your pearly whites. I hope you found this post useful, and happy Women's Health Week. And this is all I've got to say today. So this is Dr. Poornima from Hills Dental Design, where beautiful and healthy smiles begin. Thank you. Bye.